See important safety information at the end of the video. Only your doctor can determine if this therapy is right for you.
My pain is from probably my lower stomach to the tips of my toes, and it is strong enough to make me go white as a sheet, and I've passed out many times. It's not like a normal pain where you've banged yourself. It's the most excruciating, burning, searing pain, and then you get your breakthrough pain, which is absolutely unbearable. It's about 20 times as strong as your normal pain. It could last for 5 minutes, 50 minutes or 5 hours, and during that period you can't even scream because it's so bad. First of all, I was put on all the medication. It didn't really help. I was given the spinal nerve block. It didn't help. I was given a TENS machine. It didn't help. My medication was hired to have a lot of the opiates in. It didn't help. The drugs were absolutely terrible. The drugs controlled your life in every way. You were reliant on them. You become addicted. You slept all day. I couldn't eat. I could hardly speak because my words were slurred. Spent maybe 18-20 hours a day in bed, and you suffer like a drug addict. If you miss your drugs, if you're an hour late, you will go into withdrawal as a general everyday drug addict, and it is living hell. And it stops you being able to work, couldn't socialise, couldn't see any friends, couldn't get out of the house, couldn't do anything. I used to go to the gym every day. It put a halt on your life. I had no life anymore. My life was my medication and my bed, and that was it. They can't understand, they know what a toothache feels like or a bang, but they don't understand what chronic pain is and nerve pain. And my mum and dad saw all this medication in my room and used to say all the time, surely you don't need it, surely you don't need it, can't be that bad. But the medication was the only thing that was keeping me going and helping me cope with every hour of every day, because the pain was so bad. I'd rather be asleep all day long than suffer the pain. The medications that they give you are very strong. People that suffer chronic pain are prescribed them for the long term. We don't know how it's going to affect your body, and mentally it completely destroys you. So getting off the medication was one of my challenges and my biggest aims. I had no life with the medication at all. It was my pain consultant here. He discussed how the surgery was done, what I was to expect afterwards. Nothing really prepares you for for actually having this surgery. It's a very strange surgery because, of course, you're awake during the period and they keep on switching the machine on and asking you where you feel the stimulation, but you don't feel any pain at all. And the nurses were absolutely amazing, held my hand all the way through, and when they switched it on, it was like a huge concrete block had been lifted off your head. The pain is turned into an electric tingle, and everywhere you had the pain, it's now quite a pleasant electric tingle, and it's incredible. As soon as they switched it on, I felt this very, very strange. It's like having electric tingles that go from my hips to the tips of my toes. So instead of where the pain is normally, I've got quite a nice, relaxing massage electric treatment. It just stops the pain.
Right.
You don't feel the pain anymore. They told me about the adaptive stim because I am very passionate about trying to lead a normal life. I want to go for walks, I want to go to the gym eventually. I want to be able to do normal things that everybody does. And therefore I needed my machine to work with me and allow me to do these things. So certain things cause me a lot more pain, and this machine, I know, has learned my movements and will adjust itself whenever I'm doing something, from tying my shoelace or lying on my back, which I haven't done for years and years, to maybe even going to the gym again one day, having a shower. All these things, my machine will adapt itself, therefore making each activity as comfortable as possible, as well as stopping my pain. I used to take my programmer everywhere, to the cinema, to absolutely everywhere, and it was almost like I was a bit obsessed that I had to have my programmer on and with me. I don't have to take it out at all now. My machine changes itself. It feels like it's got a life of its own, and it adjusts itself to every situation, so I don't need it. I don't need it at all. The trial is such a simple thing. It's just a way of seeing, will this thing work? And for the people that it works, straight away, it's the most amazing thing. But the benefits to the patient and, to be honest, to the NHS are just so worth it. Exercise and health and fitness was my life, really. It was a major part of my life, and it just literally stopped overnight. I could no longer do anything. Now I've got the adaptive stim in, I'm going to start walking and building up my strength again in my legs, because when you spend so much time in bed or ill, you get weak everywhere, and of course that weakness leads to other problems and psychological problems, like a bit like depression. I'll say that everybody I've met that has chronic pain suffers from a form of depression because they can no longer do what they used to do. I'm extremely determined to one day get back to the gym and just get stronger and try and lead a more normal life. Now I'm off quite a bit of the medication. Everybody says that I'm a completely changed person. I used to be extremely ratty. I used to get extremely depressed. I used to be exhausted all the time. You give up. Your medication is your life, is your medication, and it doesn't completely get rid of the pain. It dulls it down, whereas my stimulator blocks the pain. So I have started seeing friends again. I can stay out longer now. Starting to rebuild life again. I mean, I charge up my battery every couple of weeks. It's the most simple thing ever. I put a belt on that charges it using radio waves, and it's charged for another 2 or 3 weeks. So I just forget it's in there, and your battery has a very long lifespan. So it's in there. It just gets off. It works, and you forget about it, and you get on with your life. It's worth it. Extremely, extremely worth it. Yeah. Yeah.
Our Medtronic implantable spinal cord stimulation system is indicated as an aid in the management of chronic, intractable pain of the trunk and/or limbs, peripheral vascular disease, or intractable pain of the posterior trunk. The most frequently reported problems following the surgery to implant a neurostimulation system include infection, lead movement, pain at the implant site, loss of therapy effect, and therapy that did not meet the patient's expectations. For a list of adverse events that have been associated with the therapy, please refer to the important safety information on our websites, listed at the end of the video. The medical procedure diathermy cannot be used on someone with an implanted neurostimulation device, as this can result in severe injury or death. Most electrical devices and magnets encountered in a normal day are unlikely to affect the operation of a neurostimulator. However, sources of strong electromagnetic interference, such as MRI and RF microwave ablation, can interact with the neurostimulation system, resulting in serious injury or device damage, depending on the implanted device. The content of this video is informative only. It does not contain nor replace any medical diagnosis. For medical diagnosis, you should always contact your healthcare professional. Always talk with your doctor about diagnosis and treatment information. Bear in mind that all therapies carry risks. This therapy is not right for everyone. Not everyone responds to spinal cord stimulation in the same way, and your experience may vary. To understand the benefits and risks, please discuss them in detail with your doctor. A prescription is required. For complete safety information about spinal cord stimulation for chronic pain, visit www.tamethepain.co.uk/safety-neurostimulation.